assistance has been requested.
Any unit available for backup?
It is because of the rise of methamphetamine. According to Malaysia Country Report on Drug issued in 2018, a total of 16,384 drug dependents were using methamphetamine. And the most shocking part is, it was reported more than 15,000 methamphetamine users had sought drug treatment admission in Malaysia compared to about 10,000 heroin users. Well, the drastic changes that have been occurred makes methamphetamines leading from other drug cases. Thus, the government and rehabilitation center play an important role in figuring out the solution to overcome this issue. So without wasting our time, let's talk about it. So what is methamphetamine and why is it dangerous? Based on National Institute on Drug Abuse, methamphetamine is a powerful, highly addictive stimulant that affects the central nervous system. Also known as meth, blue, ice, and crystal. In Malaysia, crystal form of methamphetamine, which also known by the street names as ice, meth, dimeth, glass, crystal, batu, and shabu. Yes, it has several different forms which are powder, base, and crystal. Powder form is in a white or off-white powder, generally known as speed. Powder is the least potent form of methamphetamine and is often mixed with other substances such as glucose. Next, we move on to the base. Base is a damp or oily substance with a white, yellow, or brown color. Oh yeah, by the way, base has a higher potency and purity than powder. It can vary in appearance and is known by various terms including pure, paste, and wax. Now we move on to the most common form in Malaysia, which is crystal, a crystalline substance of translucent to white appearance. Not to forget, crystal methamphetamine is the most potent form of methamphetamine.
Method of methamphetamine is taken. Methamphetamine can be used in various ways, either through smoking, injection, snorting, and also swallowing. Smoking is the most common method that is used by the substance users. Methamphetamine contains hydrochloride salts that can be smoked by itself without adding something into it. In the crystal meth or ice, it can be smoked in a small glass pipe that is called a flute. The second method is by injection. Methamphetamine can be injected into the bloodstream. The risk of injection method is the users are exposed to blood-borne infections like HIV, hepatitis A, and hepatitis B that caused by needle sharing. The third method is snorting. This method usually being used by the new users of this substance. Snorting method may lead to the damage of the sinus cavities. The final method is by swallowing. This method can be done by taking or swallowing the pill or ingestion. The pill's form of methamphetamine is produced just for medical use, but it has been misused by the substance users. Usually, the substance users taking this substance to satisfy their agitation feelings.
Okay, so we are going to learn about symptom and factor. One of the first symptoms of menopause is sudden loss of interest in an event life, such as lost interest in hobby, goals, and even relationship. Initially, many people will attempt to hide their drug use, but the longer someone uses meth, the more permanent it becomes in their life. Okay, next is the tweaking. Tweaking means a moment of anxiety and insomnia that can last for several days. When a person is abused with meth, the tweaking occurs. Tweaking occurs at the end of drug binge when a person using meth cannot achieve a rush or high any longer. Tweaking can cause psychological side effects such as paranoia, irritability. Tweaking from meth can also cause people to experience hallucination and become prone to violent behavior. Last but not least is the crash phase. During this period, the body is derived of the dopamine that meth was previously supplying and cause extreme exhaustion. A crash can last anywhere from 1 to 3 days and is characterized by long periods of sleep, intense drug craving, and depression. The first factors that contribute to rising case of meth abuse are genetics. This is because family history of drug use and dependence are more likely to become addicts themselves. There is no gene that automatically makes someone into meth addict, but genes are an influencing factor in addiction because they affect how people react and experience drug. It also relates with environment because the primary correlation is that persons raised in an environment with substance abusers are more likely to develop psychologically in a way that encourages addictions towards meth. In addition, having mental disorder also can lead to meth abuse. This is because they are finding a way to shut down their inner thoughts that is running them from living a normal life. It is a well-accepted fact that many persons with existing disorders are more likely to turn to drugs, alcohol, and cigarettes. In one study labeled smoking and schizophrenia, doctors study the correlation of some medication and mental disorders. Many persons who have mental disorder are up to 3 times to use meth. Loneliness also contributes to the factor of rising case in meth abuse. If a person has strong relationship with family and friends, they are less likely to use or become addicted to drugs than if she or he are lonely, out of touch, or have a little to no family support. Last but not least is financial crisis. People who do not have options to go out from their problems, whether financially or otherwise, are much more likely to become addicts. This means that boredom, debt, poverty, stress, and even the lack of stimulating environment all contribute to drug and addiction.
The effects of methamphetamine are it can cause anxiety, depression, mood changes, and also aggressive behavior. Besides that, the effects of methamphetamine are it can cause a person to experience several psychotic characteristics, including visual and auditory hallucinations and delusions. Psychotic symptoms can last for months or years after a person has stopped using methamphetamine. Even in limited dosage, methamphetamine can increase wakefulness and physical activity and decrease appetite. Methamphetamine can also cause a variety of cardiovascular issues, including rapid heart rate, irregular heartbeat, and increased blood pressure. The suitable treatment for methamphetamine are intervention. Intervention will help meth users to see how their actions affect those that they care about and motivate them to seek help. Next, the second treatment is through detoxification. For example, benzodiazepine medications can be prescribed for patients that become agitated as a result of their bodies adjusting without meth. After that, counseling and therapy also will help the meth user to understand the thought and behavioral patterns that brought them to abuse the drug in the first place. The most common technique used is cognitive behavioral therapy, or it is known as CBT. CBT therapy are effective for treating methamphetamine addiction as well as the co-occurring disorders of depression and anxiety. Besides that, the other technique like narrative therapy, which emphasize the importance of personal life stories, will help recovery users determine how their stories have shaped their drug use and ways to overcome these thoughts and behaviors. Counselor also will help those med users to adapt new, healthy lifestyle choices in order to build a better future without drugs.
Now, let us discuss about integrated treatment program. Integrated treatment program refers to the situation when that one provider or one team of providers deliver for both mental health and substance use services at one time. Intensive Outpatient Program, or shortly it being called as IOP. IOP is an integrated program when an individualized program or a client are allowed to do their daily activities like going to work, studying, and many others. This program will allow their clients to function independently while preparing the clients about the skills and ability before being exposed to the community world. Matrix Model. Matrix Model is one of the intensive outpatient program that has been designed to aid in recovery from the stimulant substances such as methamphetamine and cocaine. This model comprised by a variety aspects of many therapeutic style and psychological orientations. Matrix model also involves a few hours treatment for each day, several days per week, while permitting the client to stay at home and not being hospitalized.
Next, we interviewed a former drug addict for today's video. As for the interview session was being held in Malay, we provided English subtitle for those who have trouble understanding the conversation.
Assalamualaikum. Puan, boleh tak sebelum kita nak mulakan topik kita hari ni, boleh Puan ceritakan sedikit tak pasal diri Puan?
Okey. Umur 43, asal dari Indonesia tapi sudah menetap di Malaysia 21 tahun. Sekarang saya nak berkongsi tentang pemakaian dadah. Saya sudah teralami diri saya sendiri. Saya mengambil dadah ini sudah berpuluh-puluh tahun lah, dari umur 20 tahun. Saya sudah buat jahat lah dalam keluarga. Tapi pasal pergaulan. Dulu saya tak bergaul sama kawan-kawan, duduk rumah orang baik lah. Tapi setelah berkawan sama tu orang ni, dia macam tunjuk ke saya tu benda tu, ngambil ini barang. Saya pun dalam sehari 2 hari pun agak-agak tak ambil lah, takutkan. Pasal keluarga pun saya tak tahu. Jadi saya pun coba itu pengambilan dadah, obat ke apa. Rasanya macam ada kesan lah. Kesannya macam play, terus ada keberanian, terus macam rasa seronok lah dalam pergaulan ni. Jadi saya pun rasa macam menghayali nak ambil lagi satu benda ini. Rasa sedap lah macam untuk bekerja, untuk berkomunikasi ke apa. Macam play lah, untuk enjoy ke happy je kan. Jadi berpuluh tahun ini saya memang sudah mengalami, badan saya sudah banyak dadah ke obat ke saya sudah rasailah.
Jadi dalam banyak-banyak dadah yang Puan pernah ambil, dadah apa yang lebih Puan ambil? Lebih kepada lebih dari banyaklah dos dia daripada dadah-dadah yang lain.
Pil. Sebab pil untuk pil hayal lah.
Ais lah.
Bukan pil macam pil lah yang bulat tu.
Ekstasi.
Ekstasi.
Oh, ekstasi.
Ekstasi itu untuk kita enjoy. Untuk playnya, untuk enjoy lah.
So maknanya untuk bila puan pergi enjoy tu kan, sebenarnya dekat mana dan bila puan gunakan untuk enjoy?
Untuk enjoy pergi pub, misalnya pergi pub untuk macam untuk berdisco, menari, untuk macam minum-minum, untuk melayan customer yang enjoy happy-happy sama-sama lah, tapi sebatas menarik je. Itu tak lebih dari itu.
Puan ambil dadah tu sebab lebih kepada untuk bekerja lah,
bekerja.
daripada bersukaria, lebih kepada bersukaria, lebih kepada bekerja.
Bekerja.
Okey.
Jadi badan tak rasa penat ke apa. Jadi macam rasa segar je badan ni.
Jadi itulah salah satu kesan-kesan
kesan-kesan.
ambil dadah tu lah, kita rasa lebih tenaga.
Jadi badan kita pun rasa macam dululah berisi lah, jadi udah pemakaian ni jadi rasa merosot macam kecil lah, badan kurus macam itu. Jadi efek itulah dari obat tu.
Daripada ubat tu lah. Jadi sebab puan ambil dadah, kita dah tahulah tadi sebabnya puan ingin bekerja
terus ingin happy, nak merasai lah macam mana semacam orang-orang yang di luar, kawan-kawan happy macam tu.
Oh, sebab terpengaruh dengan kawan jugalah. Saya faham. Jadi daripada sekarang ni pun puan dah berhenti kan, walaupun daripada 20 tahun sebab mengambil dadah tu, dan sekarang ni puan dah berhenti. Jadi macam mana bila sebenarnya puan mula berhenti ambil dadah tu?
Mula ni kurang lebih 7 tahun. 7 tahun. 7 tahun dah berhenti. Itu pun pasal saya sudah macam ada orang yang betul-betul ke diri saya nak menikah. Nak betul-betul menikah. Jadi semua orang tahu saya main itu benda itu kan. Tapi saya nak tunjuk ke orang tu saya tu nak baik. Pasal ada orang yang menikahi saya kan apa. Ini jadi saya boleh berhenti pelan-pelan macam lupakan tu benda tu kan, barang tu.
Mungkin sebabnya puan berhenti ambil dadah sebab ada orang yang mahu berkahwin dengan puan. Jadi sebab itulah puan rasa bertekad.
Tekad dah nak lupakan tu benda tu.
Faham. Waktu puan berhenti tu ada cara tak puan cuba untuk berhenti ambil dadah?
Cara tak ada, cuma kita untuk dari hati kita sendiri.
Lebih pada motivasi
kita sendiri lah. Kita macam ada ingat lagi itu benda tu. Ingat macam mana, ingatlah berpuluh tahun kita main benda ini mesti ada ingat juga. Tapi cara kita untuk tak ingat macam mana. Kita macam ada kawan untuk seimbang sama kita, ada kawan yang dekat sama kita untuk seimbang bahawa kita untuk lupakan itu benda.
Sokongan daripada kawan-kawan jugalah. Alhamdulillah lah puan ada kawan-kawan yang macam tu.
Ada.
Bantu puan. Jadi kalau waktu puan cuba berhenti ni kan, mesti puan ada fikir juga macam nak sambung balik, teringin nak ambil balik kan. Ada tak apa-apa halangan atau cabaran semasa puan cuba berhenti ambil dadah?
Itu masa berhenti pun rasa ada 50-50. Rasa nak terjun lagi ke dunia ini lagi atau apa ni. Tapi kita fikir lagi, kita di umur sudah berumur lah. Kita tak mampu lagi, nanti takut suatu hari kita tak tahu lah overdose ke apa dari penyakit ni kan. Jadi ada sikit berhenti lah. Saya pun rasa kalau berhenti pun rasa macam luput lah semua. Nak luput macam tu lah. Niat kita lah dalam hati.
Lebih pada sebab fikir nak ambil tapi kita tak ambil.
50-50 lah.
Alhamdulillah lah sebab sekarang pun dah berhenti kan 7 tahun dah.
Alhamdulillah.
Saya nak tanya puan, ada apa-apa perubahan tak lepas puan berhenti ambil dadah?
Ada perubahan. Dalam badan kita dari macam kecil ada perubahan. Macam ada semangat lagi. Nak naikkan badan, terus makan kuat.
Ada selera
makan. Kalau main ini dadah tak akan makan. 1 minggu boleh tak makan. Cuma air minum cuma makan cemil itu pun tak nak. Niatnya itu benda itu je.
Sebab tapi lebih kepada nak dapatkan dadah tu daripada makan. Tak payah makan dia.
Tak payah makan. Yang penting ada dadah. Macam itu. Tapi lepas berhenti makan tu je. Makan kuat macam kuat. Terus kita pun lupa lagi. Tapi kalau kita bergaul lagi sama orang kita terbawa lagi lah.
Pandai. kena pandai memilih kawan juga lah dekat
yalah.
situ. Jadi kita hentikan sesi temu bual kita ni. Ada apa-apa tak pesanan Puan kepada orang yang cuba ataupun orang yang ingin mengambil dadah ni?
Bagi diri saya lah, untuk orang-orang yang di luar, tolonglah jangan ambil dadah serupa ais ke obat ke. Itu akan memudaratkan badan kita dan merusakkan segi keuangan ke, pendapatan kita ke. Tolonglah yang di luar jangan ambil dadah.
Walaupun nak
cuba tak boleh. Sebab saya sudah mengalami, saya cuma mengingatkan yang di luar.
Jadi itu sajalah. Jadi Puan terima kasih sebab sudi ditemu buat oleh saya dan juga rakan-rakan saya. Dan apa yang saya harap orang luar tu bolehlah terima balik apa daripada bekas penagih dadah tu sendiri, pengalaman dia sendiri, pengalaman Puan sendiri. Saya harap dapatlah memberi apa-apa impak pada mereka. Jadi sekali lagi terima kasih dan Assalamualaikum.
So in conclusion, even though methamphetamine's usage in Malaysia is decreasing over time, we as Malaysians should know the dangers of misusing them. If you have problems related to substance abuse, do not hesitate to seek help from your friends, family, or even professionals such as counselors or psychologists. And that's all from us. Thanks for watching, and please say no to drugs.